to Aesthetic TV. I'm Stuart Brazel, coming to you from the stage of the Aesthetic Show in Las Vegas. The market for non-surgical body shaping procedures has grown exponentially over the last few years, driven by an increase in patient demand for non-invasive solutions that offer less pain and zero downtime. The ULTRASHAPE Power from Syneron Candela is the latest aesthetic medical device that provides superior body contouring results via non-invasive mechanical ultrasound energy. This upgrade to Syneron Candela's successful ULTRASHAPE device promises the most comfortable energy-based fat reduction procedure on the market with an unprecedented 30% reduction in fat layer thickness. Here to tell us why is Dr. Julene Samuels, a plastic surgeon from Louisville, Kentucky. Welcome, Dr. Samuels.
Thank you, Stuart.
We've had physician guests on Aesthetic TV describing the ULTRASHAPE device. What are the most breakthrough features of the new ULTRASHAPE Power system?
Well, ULTRASHAPE Power is a state-of-the-art body contouring device that provides 20% more energy, and as you mentioned, a 30% reduction in fat layer thickness when you measure that by ultrasound. So it really delivers unsurpassed fat destruction more quickly, safely, and comfortably. And since there are no thermal effects, the treatments are completely painless. So the surrounding tissues, the nerves, the blood vessels, they're unharmed, selective for fat, and there are no visible signs of treatment.
So there are no nagging irregularities of the skin after treatment?
Not at all, and that's one of the places it excels. The beauty of ULTRASHAPE is that, especially ULTRASHAPE Power, is that you can use the new U-Sculpt transducer to correct micro irregularities as well as to treat larger areas. And it's the only system on the market really then where treatments can be truly 100% customized for each patient. No applicator imposed restrictions on the treatment size or the body shape. And because the ULTRASHAPE Power is not an applicator-based system, there are no clear lines of demarcation between treated and untreated areas. So as a result, outcomes are more homogeneous and the results are more aesthetically pleasing. So in my practice, after just 3 sessions with the ULTRASHAPE Power, we typically get measurable fat layer and circumference reductions much sooner than with other thermal-based treatments, and in less than 2 weeks, patients are experiencing results.
How does ULTRASHAPE Power work exactly?
It employs a pulse delivery of focused ultrasound energy, which causes immediate fat tissue destruction, enabling noticeable and long-lasting results. So the device's energy really converges into a precisely confined focal volume, targeting only subcutaneous fat at a controlled depth. Since the energy is pulsed, meaning that it's delivered in bursts, which results in a non-thermal mechanical effect, this causes treatment experiences that are completely painless because there's no elevation in the tissue temperature.
I understand that the applicator for ULTRASHAPE Power uses new and improved technology.
Right. One of the things that makes ULTRASHAPE Power and ULTRASHAPE different than competitive technologies is the ability to treat not just a larger area, but to also do what's called micro contouring. So we can correct irregularities that are hard or if not impossible to treat with other competitive devices that are limited by transducer size or the way that transducer is applied to the tissues. The maneuverability of the smaller transducer, because it's smaller, is easier for my technician to perform. And there's a new advanced mode that we call fly mode, and that allows us to further reduce treatment times in our aesthetic treatment area.
What treatment protocols do you use with the ULTRASHAPE Power?
We do 3 treatments at 2 to 4 week intervals. We have patients who are dealing with problems that are diet and exercise resistant, moderate to significant unwanted fat. We like our patients to be hydrated because ULTRASHAPE employs an ultrasound energy and it requires a fluid medium for its best transmission of that energy. And much like you are eliminating fatty meals or weight loss, that's the way the body eliminates the fatty tissue after an ULTRASHAPE treatment. So we like for patients to avoid alcohol for 24 hours because part of that elimination, it does involve the liver. But to remain well hydrated. Other than that, there are really no recovery recommendations. The patient just goes back to their normal lives and exercise and healthy diets, hopefully.
How does ULTRASHAPE Power compare to other non-invasive body shaping systems on the market?
Well, first of all, you're able to treat a much larger area, 50% larger area than any other treatment device on the market. We are able to reduce fat, volumetric fat reduction, about 25% more than any other device on the market. And we have no problems contouring an entire area. In other words, we have no mist zones that can lead to skin contour irregularities or shelving that you can typically see with other devices. And additionally, we're able to see treatment results within 2 weeks of the first treatment. And most other technologies require that the patient wait 6, sometimes 12 weeks or more to start to see results. That makes my costs as a practitioner lower per treatment. It makes fewer numbers of treatments necessary for patients to experience results, so that's less cost to them. And it's comfortable, and there's no downtime.
What other features do you get using the ULTRASHAPE?
There is a whole new set of software and the handpiece ergonomics, the data collection, the remote diagnostics, the remote software updates that are now available with the ULTRASHAPE Power. It's a highly advanced database that allows reporting for patient treatments and between treatments. So it's a device that's much smaller than the original ULTRASHAPE, so it's very portable from room to room, as well as I said, that highly ergonomic handpiece.
Do you use ULTRASHAPE Power in conjunction with other devices and therapies, or does it replace those devices?
Well, ULTRASHAPE really can be a standalone treatment within your practice. It is the best fat-reducing technology on the market. It doesn't directly tighten skin, so if a patient does have some skin issues, you may want to couple that with one of your skin tightening devices. But as long as the patient doesn't have really lax skin, the treatment results, because of that ability to micro contour and treat thoroughly an entire aesthetic unit, skin contour irregularities, even if you aren't coupling it with a skin tightening device, are really very good. So it can be standalone, it could be coupled with some of your other devices for patients that want both volumetric fat reduction as well as skin tightening.
How would you characterize technical and after-sales support from Syneron Candela?
Well, I have a lot of devices in my practice, and I've always used non-surgical measures for my surgical patients, even though I'm a surgeon, and I think that's important. So I have a lot of device relationships, but the relationship that I have with Syneron Candela is quite a bit different. They will support you after the sale by giving me what's called a practice development partner. And she is someone who's dedicated to my account. She checks in with my staff. She makes sure that we're successful in offering these options for patients, and they help you with the marketing. So it's an ongoing relationship. In addition to that, as a surgeon, I appreciate partnering with companies that remain innovative. And I'm not just buying a device that then has no further update. So Syneron Candela is always, I sort of call them the company with the finger on their pulse. I have 4 of their devices, and they continue to update those and innovate those. So I know that I'm not investing in static equipment.
Well, thank you so much, Dr. Samuels, for introducing ULTRASHAPE Power to our viewers. For Aesthetic TV, I'm Stuart Brazel. Stay tuned and stay beautiful.